Good morning. Today, I will analyze the accuracy of reporting of SARS-CoV-2 or COVID-19 infections across 6 countries that I've extensively studied about. Firstly, I believe that some countries prevented the spread for COVID-19, and I think that is primarily due to their honest reporting and statistics. These two pictures show both the degree of restrictions and the number of confirmed cases. In order to evaluate the extent to which each country prevented the spread of COVID-19, I believe that each country should not just look at how many people got infected or died. Instead, the countries should look at how much COVID-19 spread into the country and respond in order to reduce the spread of COVID-19. By analyzing the accuracy of reporting of COVID-19 data, I would like to share some viewpoints in order to create a great response to COVID-19. There are countries such as South Korea or the United States that confidently release the data of confirmed cases and daily deaths. However, I think that some of the countries do not do so in order to deceive the citizens that they are responding to COVID-19 in such a great way. In order to investigate this claim, I wanted to get statistics, plot them on a graph, and identify any significant anomalies. From the beginning of 2020, COVID-19 pandemic has started, which prompted governments and international organizations to launch a global response. Although some data was shared, I was unsure of the anomalies that were associated with the data, and that is the reason that made me research and complete this paper. To assess the accuracy and precision of COVID-19 data reported by various nations, I used a suite of statistical tools comparing epidemiological data from South Korea, the United States, the United Kingdom, France, China, and Japan. I have gathered COVID-19 data from multiple sources to ensure the robustness of our study. I mainly use official government health agencies and international organizations such as the US Center for Disease Control and the World Health Organization. I use the COVID-19 data repository by the Centers for Systems Science and Engineering, or CSSE, at Johns Hopkins University, which collects and standardizes data from these primary governmental and international organizations. The data collected includes the number of reported new cases and deaths from 2020 to 2023. Also, I use NumPy and Pandas to analyze the data, and I drew the graphs with Matplotlib. During the process while I was making the paper, the results of the study will help clarify the precision and correctness of COVID-19 data globally and offer international organizations strategies and tools for fostering confidence among cooperating countries in times of global health emergencies. For public health policies and decision-making to be effective, truth in the data provided is necessary. So you might wonder what I did to compare and identify anomalies. Well, I used Matplotlib to plot the number of confirmed cases, the number of deaths, and their per-case mortality rates to find any possible patterns or anomalies. Matplotlib is a Python-based comprehensive library to create both static and interactive visualizations such as graphs. Instead of storing all of the COVID-19 data into one single massive table, which decreases the readability, using a graph can help visualize at what date approximately did the anomalies occur. I did not find any of these cumulative cases, daily deaths, and mortality rate graphs that show the full extent of COVID-19 spreading around the world. As you can see in the two codes in the slide, I read the CSV, comma-separated values of the COVID-19 confirmed cases and deaths data from the world as well as from the United States. Also, I decided to use a moving average function, as you can see on the picture on the right, in order to clearly visualize the number of deaths per day. You can see the previous method of graphing and the proposed method of graphing. While the previous method, as you can see on the left, the day ranges from March 14th, 2020 to December 7th, 2020. However, the method that I use employed a full range of dates, or from January 2020 to January to February 2023, which covers about 4 times the date range than the previous method. Additionally, by listing the number of deaths instead of the case fatality rate that is shown on the graph on the left, one could clearly see the anomalies that can be associated with the statistics being reported. For the results, one notable inconsistency observed in China's reported data was the massive underreporting of the true number of cases relative to its population size. While Japan, with a population of approximately 123.3 million, reported a cumulative number of cases indicating around 30% of its population infected, China's cumulative count marked less than 0.7% total population infected, despite having a population that exceeds 1.4 billion people. This contradiction questions how reliable factual information from China is, especially regarding overall total number of cases as well as daily death updates. Furthermore, China's reporting irregularities were not limited to case numbers, but also extended to mortality rates. While other countries exhibited two primary peaks in reported deaths, as you can see right here and right here, China's reported exceptionally high daily death numbers in 2023, surpassing 10,000 deaths per day. Such anomalies, coupled with the rapid decline in mortality rates, as you can see here, suggest potential data manipulation and censorship. Additionally, on approximately February of 2022, China's mortality rate dropped significantly. However, the total number of cases did not increase and the daily deaths cannot be seen. This is a contradiction because the mortality rate is defined as the number of deaths per number of cases, and hence mortality rate should be consistent. However, the dropping of the mortality rate suggests that there is a clear contradiction that arises from the reporting, and hence this must be an anomaly. These findings highlight the importance of transparent reporting and international cooperation in accurately assessing the impact of global health crises such as the COVID-19 pandemic. Now, I will draw some conclusions based on the results, the graphs, and the statistics about epidemiological COVID-19 data. All of the figures show that China's statistics of COVID-19 cases were massively underreported, which suggests that China's government must have manipulated the data significantly to deceive the citizens that China responded to COVID-19 very well. China currently claims that the low number of COVID-19 cases and deaths is due to their successful handling of the situation. At this point, when we must prepare for the possibility of similar pandemics post-COVID-19, it is critical to assess and evaluate their claims objectively. I believe my research provides an impartial assessment of each country's response to COVID-19 through the analysis of data from 6 nations. Additionally, by pointing out and highlighting any errors present in these assessments, I believe it can aid people in making informed and rational judgments. These are my works cited page, and thank you very much for listening.